So now, I am also going to start with the Ayurvedic remedial therapies, which is a part of your curriculum. Because I think you are supposed to undergo practical training for this in the month of January. Okay, because so if you are undergoing it in January, you need to finish the theory part before that. So that is the reason I'm starting this now. So simultaneously, we will finish this also. So you know, going forward. So Ayurvedic remedial therapies, obviously, you are not really studying Panchakarma as such because Panchakarmas are not a part of your curriculum, your study. You are mainly studying the allied karmas, you can say. Okay, the allied procedures, that is what you're going to study. But the conceptual understanding has to be there, so that is what we will do. So basically, Panchakarma is the five processes, five procedures. Panchakarma are mainly the Shodhana processes. Shodhana means cleansing processes. They cleanse the body. What are these for? These are for removing excess doshas out of the body from the nearest possible opening. That is the idea of Panchakarma. So this is removing excess doshas. So understanding has to be there that Panchakarma is not usually done when the doshas are not excessively aggravated. You will only do it when the doshas are in excess quantity, and it is difficult to pacify these doshas by way of shamana or pacification treatment. These karmas, these panchakarma procedures are, before you do these panchakarma procedures, there are certain procedures which are done which are called as purva karma. Okay, the purva karma, and purva karma includes dipana, pachana, snehana, and swedana. These are the purva karma before the actual procedure is done. Now, the dipana, pachana, snehana, and swedana, we will study those in detail, but this is just an introduction that I'm doing. Now, when we do therapies, the therapies are usually of two types. Either the therapy will increase your strength or the therapy will reduce your strength. So when we say increasing the strength, it is called as santarpana, and when it is decreasing the strength, it is called as apatarpana. Tarpana is nourishment, apa is reducing, santarpana is increasing. So there are two types of treatments mainly: santarpana, which increase the strength, and the others which reduce the strength. The panchakarma processes, which are the shodhana type of treatments, they are mainly apatarpana type of treatments, which will cause weakness and debility of the debility in the body. It will also cause digestive system functioning to be impaired. It will reduce the digestive functioning to be. It will reduce the digestive functioning. So post panchakarma, your digestive functioning is reduced a little bit, and hence specific dietetic regimen is adapted post panchakarma to slowly stimulate the digestion without causing in any side effects on the body. That is called as samsarjana krama. Okay, so the idea is when you decide to do panchakarma, you have to undergo something which is called as purva karma, okay, which includes dipana, pachana, snehana, and swedana. Dipana is stimulating agni, pachana is digesting, snehana is oleation, swedana is fermentation. And after the actual treatment, because the agni is weak, to improve the agni, immediately after the procedure, if you start with your regular diet, the regular diet will cause disturbance with the agni because the agni is not strong enough to digest your regular food. So gradually the food quantity and the quality of the food is increased from light to heavy to small to the regular quantity. That is included in samsarjana krama. That also includes rest post the therapy to improve your physical strength. So that is basically how you do the panchakarma in general. So when the doshas are associated with ama, dipana and pachana is implemented. Okay, whenever the doshas are associated with ama, you will do the Dipana Pachana before doing the Snehana and Svedana and before doing the Panchakarma. We have spoken about this, that you will not be undertaking Panchakarma when there is Ama presence in the body. Okay, you will not directly undertake Panchakarma when you are doing the when there is Ama presence in the body. So we have not said that you cannot do Panchakarma, but before doing Panchakarma, Dipana Pachana will be a part of it. So start with Dipana, follow it up with Pachana. Then once the Ama is digested, then start with Snehana, oleation, then do the fermentation, and then do the Panchakarma. That is how you will do it. Okay? In normal cases also, before you start the Snehana and Svedana, because most of the people have a little bit of Ama at least in the body, okay, it is advisable to do Dipana Pachana for 3 to 5 days and then start with Snehana and Svedana. To take care of whatever small quantity of Ama might be there in the body, it is advisable that you do Dipana and Pachana and then you start with the Snehana and Svedana. Now, why are we studying this? Because all the allied karmas that we are going to talk about are mainly part of Purva Karma. Okay, they are mainly the types of Snehana and Svedana, nothing else. Okay, and that is why we are studying this in detail, so that you understand what are the karmas, what are the procedures to be done. What is Snehana? Snehana means introducing unctuous substances in the body. This can be done either externally or this can be done internally. So you actually consume the oil, ghee, etc. orally, or you apply it on the body externally. So it can be done externally as well as internally. It is called as oleation. It stimulates mobilization of doshas from the site of affection. That is, it mobilizes the doshas from the dhatus towards the kosha. That is the basic concept of Snehan. Mobilizing the doshas from the dhatus towards the kosha. That is the idea behind Snehan. Now, what is... Okay. Then the next is Svedana. What is Svedana? Application of heat to cause fermentation or sweating. That is Svedana. It is called as fermentation. It stimulates mobilization. So Snehana and Svedana together will help in mobilizing the doshas from the dhatu towards the koshta. So that is like a preparation of the body to bring the doshas into the koshta, which is the digestive tract, so that when you do the Panchakarma procedures, the doshas can be eliminated out from either your mouth to your lower orifices, depending on wherever the doshas are predominantly present. Where the doshas will be present? When we say the doshas are brought from dhatus into the koshta, they are going to be brought into their main areas. So if it is kapha, it is going to be brought into the stomach. If it is pitta, it will be brought into the stomach and the small intestine. If it is vata, it is going to be brought into the colon, because those are the main sites in the digestive system for these doshas. So when we say the doshas are brought from the dhatus into the digestive system for their removal, they are going to be brought in these areas. And that is why, because for the stomach, the nearest opening is the mouth. That is why for kapha, you do vomiting. For the small intestine, which is pitta, stomach and small intestine, which is the pitta, purgation is the root, you do the purgation. But please remember, vomiting or emesis also causes removal of pitta. Okay, so though vomiting has been suggested as a treatment of choice for kapha, it is also done for pitta. Sometimes when people have reflux and GERD, doctors advise vamana, which is emesis, also as a treatment to remove excess pitta. But purgation is the method of choice for pitta removal, which is loose motions, diarrhea caused by medicines to remove excess pitta from the lower orifice. And when it is vata, the dosha is coming into the colon, which is the large intestine, and that is why enema or basti is the choice of treatment for removal of these doshas from the lower orifices. Navamana, removal of doshas from mouth by vomiting, emesis. It helps in removing the kapha and pitta. Virechana, removal of doshas from the anal opening by purgation. It is called purgation. It removes pitta and kapha. When I say kapha and pitta, kapha main, pitta is secondary. When I say pitta and kapha, pitta is primary, kapha is secondary. Okay? Basti, removal of doshas from the colon by evacuating enemas. It is called as enema. It is for removing the vata out of the system. Yes.
So in the case of the basti, the internal radiation for remove the vata internally, then how do you really remove that? You gonna like kind of directional or I never remember the other the vomiting or not?
Can you repeat this first part?
When you do the basti and the internal radiation for removing vata, then this vata, you will remove this vata by virechana or vomiting or no? Just with the radiation is enough.
So when you look at the oleation snehana therapy, okay, with the basti, usually when you are doing the oleation etc., you are doing mainly the swedana therapy in case of basti. So the purva karma for basti is slightly different. Okay, and and if I've understood your question correctly, what you're trying to say is how do you remove the vata out of body? Is that what you're saying?
Yes, like you put the oil for pacify the vata, but then is enough like that, or this vata is gonna be how do you say this vata will expel.
So it accumulates,
Yeah, like,
and then you want to expel
it
out.
somehow, or just with the radiation.
No. So because if suppose understand that when we do panchakarma, okay, the panchakarma is done for excessive doshas in the body which cannot be controlled by pacification treatment. That is the basic fundamental principle. Okay, so the doshas have to be aggravated so much that pacification treatment is not going to help correcting it, or in other words, pacification treatment is going to take very long time for correcting the problem. So to answer your question, if we go by this principle, if I decide to do oleation just for vata pacification, I will have to continue doing oleation for a very, very, very long time to just pacify this vata. Because the quantity of vata aggravation itself is a lot. So that is why in those cases, you bring the doshas into the koshtha and you do enemas which will remove the vata out of the body.
And how do you remove this vata out? Just with the basti?
Yes.
Okay.
How?
Yeah.
So there are two types of enemas given. Okay, there are enemas which are pacifying enemas, okay, which are given. Okay, those pacifying enemas are done by oils, okay, which are used in smaller quantities. Say 30 milliliters to 60 milliliters of oil is introduced into the body, and this oil is allowed to remain inside the body. Okay, so what it does, it goes inside, it pacifies vata, stays inside. When you are doing the shodhana, expelling type of enema, evacuating type of enemas, those enemas, the quantity of liquid going in is larger in quantity. Okay, it will be 200, 300 ml, 400 ml, 500 ml also. So this enema may not necessarily be oil. it will be oil with decoction, oil decoction salt, it may be milk decoction oil. So it will be different combinations which will be introduced inside the large intestine, but this enema has to come out of the body within a stipulated time period. So this liquid that is introduced in, the body will remove it out automatically within a time frame of 45 minutes. Removing the vata out of it along with it. So it will carry the vata out of it, remove the vata out of it. It will not be doing pacification. If this enema substance remains inside the body for longer time than 45 minutes, then you have to introduce certain substances to remove it out of the body, because these substances remaining inside the body are going to cause harmful effects in the body. So there are two types of enemas which are given. One is a pacifying type of enema for which the substance is necessarily oil and the quantity is small, and the enema material did not come out of the body. Did not. But when you are doing evacuating enemas, which are stronger, which are more potent, which are more invasive, there the quantity of liquid pushed inside the body is larger, and there the substance has to come out of the body, bringing the excess vata along with it. Now the question is, you may be thinking, and you may not be asking this question, but I will only ask that question on your behalf, as to how do you understand that the vata is coming out?
That was my question. Like how? Like it's a normal evacuation or how?
Correct, that's the question, right?
That was my question.
So I'll give you an example which will, I'll explain you a little bit more so that you get an idea as to how this happens. So I will explain the process. Pedro, you have a question? Okay, sure. So I will explain the process of vomiting, which will make you understand this whole process related to how things change based on what dosha is coming up. Okay, and it will also answer the question which you and a lot of others might be having, that when we put enema substance inside, which is liquid, and we are saying vata is coming out, what exactly comes out? Is it like gases coming out, the person starts farting a lot? What happens exactly? So I'll explain that so that you will understand what exactly happens physically. So in a vomiting treatment, usually a person, this treatment is given for kapha and pitta. Okay, like I said earlier, kapha, pitta. And in these cases, the person is asked to drink certain liquids orally. Okay, and the quantity of liquid the person drinks is so much that the person is unable to drink it any further. So usually either a sugarcane juice or a licorice decoction or a mixture of licorice decoction and sugarcane juice is used. Now, everybody must have tried licorice, gummies and candies at some point of their life, maybe. If not, try them out and try eating, a few in a day, and tell me if you don't feel nauseated by the end of the day. So the sweetness of licorice is very, very peculiar. It is so sweet that after a certain time, when you consume it too much, you start feeling nauseous. Okay, you'll feel nausea, you'll feel like, oh, it's too much, I cannot eat it any further. So the idea here is that when we do Panchakarma therapies, the substance that we are introducing in the body should not cause any irritation of the system and cause the procedure. So whenever you are giving vomiting, when you have consumed something which the body is not, used to, or a foreign substance or something which is gone off, or some kind of toxic substance, you vomit. But when you vomit, it causes a lot of pain in your abdomen, pain in your chest. It creates a lot of pressure on your system. A lot of cramping happens in your stomach. This is basically invasive, and this is basically traumatic. But when you do the Panchakarma procedures, it is not traumatic or painful the way we know vomiting to be. So the idea is, in case of vomiting, for example, sugarcane juice licorice infusion is given. How much will the person drink in the first go? Guess.
A glass, one glass.
One glass. So the person is asked to drink. Okay. Now obviously the person, after one glass, two glasses, three glasses, the person is going to start to say, no, I cannot drink. But the idea is the person has to drink so much that it will automatically come out of the body without any stimulus. You don't have to put your fingers in your mouth and stimulate vomiting. No, it has to come out naturally. So usually the person is asked to drink a substantial amount of quantity that can be as close to 2 or 3 liters to start. And then the person will have probably the first bout of vomiting. Now, when the first bout of vomiting happens, the substance that is thrown out, the person has consumed what? Sugarcane juice and licorice infusion. Okay? Understand the physical appearance of that substance. Even if you just give licorice infusion, okay, it is a decoction, watery, brownish in color, brownish yellowish in color, of the consistency of water. Correct? When it goes in the body, and what comes out in the first bout, when the kapha is being thrown out, you will find mucus, frothy, heavy, thick liquid coming out. So what has gone inside and what is coming out, you can clearly see the kapha being thrown out with the liquid. Now one bout is not enough. You will have to continue this person, you have to continue to ask this person to drink. 2 bouts, 3 bouts, still the person will continue to throw the mucousy substance out. So the person is still throwing out the kapha out of the body. After this, what happens is, while the person is throwing out the kapha, the person will feel very lazy, very lethargic, very tired. Why? Because kapha is being thrown out of the body. The kapha is so increased in the body, it is being thrown out, so the person will tell you this. Person will doze off while sitting because of the kapha. You have to keep that person awake and make him drink the liquid. Once the kapha finishes, in a spur of moment, the person will tell you that, I have started having headache. That is an indication that now the pitta is ready to be thrown out. And then when you make the person drink, the liquid that comes out after that will be yellowish in color, will be, having a smell of pitta, acidic in smell, etc. And the headache will increase gradually, and after the entire pitta is thrown out, within a split second the headache will stop. So it is so, like every bout you will see the difference. So that is an indication that the pitta has finished. Then you do one more bout to remove whatever excess pitta, remaining pitta is there. But the last bout that will come out, it will be more liquid than what the substance has gone in. You will feel as if it is more liquid, it is more diluted, it is more, frothy, but frothy in a way where the foam comes and it disappears. So you can understand that this is typical vata kind of liquid that is coming out, which is more liquidy, more diluted, frothy but not fibrous, thick. The density is not there, it is just frothy liquid, light liquid. And when such a liquid comes out in the last bout, that is when you stop the vomiting. So the reason I explained you this is that we always believe that, vata, pitta, kapha in the body, you cannot physically understand the changes they will bring out in the substances. But when you do panchakarma and when you see what the body throws out of the body, you will clearly identify that this is kapha being thrown out, this is pitta being thrown out, and this is vata being thrown out. In the same way, when the basti treatment is done, when the enema treatment is done, and you introduce, say, decoctions and oil, etc., the liquid that is coming out is going to be frothy, more diluted, more liquidy in nature, where you can understand that it is more vata mixed in it than just the liquid that you had introduced inside the body. Physically, you can make it out that there is a difference between. Just like I told you earlier that when you do bloodletting, the blood shows characteristics of vata, pitta, kapha. The vata blood is very liquidy. It's very light, it is very frothy. The pitta blood is very strong in color, has a very strong odor. The kapha blood is fibrous, stringy, it sticks to the tray in which you have removed it. So those are the characteristics, and those can also be seen in the substances that you have introduced in the body, as for vamana or for even the basti. For purgation, the entire process is very different. The purgation substance is taken in smaller quantities, which will stimulate the bowel movements to be stimulated, and the bowels will be thrown out. So you will not really see any medicine coming out with that. It is just the bowels stimulated along with water and the feces thrown out. But in case of vamana, you actually see the kapha, pitta and vata being thrown out. And also in the enemas, you will see the vata being thrown out, particularly when you are doing the shodhana type of enemas. Is it clear, Francesca? Does it answer your question?
So you vomiting vata?
Sorry?
So you vomiting vata? Do you vomit vata? Is that right? I understand well.
So when you do vomiting, you start with removal of kapha, then pitta, and the last bout you will see, like what is the indication? When do you stop the vomiting process? So they have said that when you see in the last bout, that there is vata being thrown out, like the liquid is more frothy, diluted, more lighter in color, that is an indication that the vata is thrown out now. Stop it. Because we don't want vata to be removed out excessively, because that will cause aggravation of vata and cause problems in it. But you cannot let pitta also remain in the body, because if you do the process incomplete, the remaining pitta in the body will then start causing problems in the body, and incomplete vamana can cause serious kind of complications and diseases in the body. So proper removal of kapha and pitta is necessary, and that is why the last bout, where do you stop? The indication is when the bout that you have has no yellowish color, no strong smell, no strong color, is just a clear, frothy, watery liquid. That is an indication that all the kapha and pitta has been thrown out, and now the body is starting to throw out the vata. We have to stop it.
So when you do the internal basti, for removing vata, you need to remove also kapha and pitta first. No.
No.
Also I don't understand.
You're asking where the basti comes out, right?
Yeah.
Where the basti comes out? The basti comes out through the anal opening.
Okay.
Enema is given through the anal
So
opening.
it's
Oh, if that was the
evaporation.
question.
Yeah.
Okay, sorry.
Okay. No, it's fine.
Sorry. We said that it is the okay. So removal of doshas from the colon via the anal opening is what is expected in enemas.
Okay.
Okay?
Yeah.
Yeah.
Okay. Thanks.
So kapha and pitta are not removed by enemas.
Okay.
Okay, clear. Now Rakta Mokshana, basically it is bloodletting. It is either from the veins directly or locally from the affected area. So you will remove the blood directly from, say, if there is shingles, if there is herpes, then you will directly apply leeches on that. If there is any skin condition, you will directly apply leeches on that, or you will remove the blood systemically from the vein in your arms. It removes Rakta and Pitta. So this is removing Rakta Pitta, and obviously if the Rakta is associated with a particular dosha, that will also be removed, but mainly it is a Rakta removing process. Now Nasya. Nasya is basically removal of doshas from the supraclavicular region by nasal administration of medicine. Now here also, just like we spoke about in enemas, which is the basti enemas, enemas are of two types. One is the pacifying enemas and the other are shodhana, that is evacuating enemas. Same way the nasya are also of two types. One is the pacifying nasya and the other is evacuating or shodhana type of nasya. Okay, so removal of doshas will happen only when you are doing shodhana type of nasya. Okay, the pacifying type of nasya is where you use the nasya on a daily basis, couple of times. Like if I ask you to put 2 drops, 3 drops in each nostril, that is pacifying type of nasya. That is only going to pacify the doshas in your supraclavicular region. Clavicle is the collarbone. Okay, clavicle is the collarbone. So above this area, whatever region is there, the doshas from this region are to be pacified or removed. Pacified by nasya, removed also by nasya. The evacuating type of nasya is done with larger quantities of medicine, going up to about 30, 36 drops, 40 drops of medicine in each nostril. So it is a stronger procedure. It is more potent procedure. It is also done with oils, or it is done with decoctions and milk together, etc. So that is the nasya. All doshas from the supraclavicular region are treated with this. Mainly the nasya is done today on a daily basis. That is called as the pacifying type of nasya, where you put 2 drops, 3 drops twice or thrice in a day. That is pacifying type of nasya, which will pacify the doshas in this region. Samsarjan Krama, like we said, it is specifically the diet that has been given, which starts with very light, liquidy kind of diet without any solids in it, and gradually increasing the quantity and the quality from light to heavy, from liquid to solid. So this is a process which is done over 7 days to gradually stimulate the Agni and gradually bring it to normal before you take your normal food. Okay, so after the Panchakarma, the person is not allowed to take the normal food immediately. The person has to undergo the process of samsarjana, that is strengthening the Agni, for about 7 days before moving on to the regular diet. You cannot directly go on to the regular diet. It will cause severe problems of ama in the body. The body will not be able to digest the food. Ama will be formed and the problems will aggravate. Do not ever start with the entire thing immediately. So then after you have done the Samsarjan Krama, then whatever little bit doshas are remaining, you can pacify them with the pacification treatment by giving medicines orally, and then that has to be followed by Rasayana Chikitsa. So when you are doing the process, it will start with Dipana, Pachana, then the Purva Karma, that is oleation, fermentation, then the actual process of Panchakarma, followed by the Samsarjan Krama for 7 days, followed by the pacification treatment, followed by the Rasayan. That is the entire regime to be followed for proper line of treatment for Panchakarma. Now, what is the scope and method of Panchakarma? It cannot be administered in every case and every patient. Please understand. Today, it is being marketed like it can be taken off the shelf. No, you cannot do Panchakarma on every patient. It has to be done only in cases where the dosha aggravation is very high. It is to be done only in physically strong people. You cannot do it in physically weak people. You cannot do it in people who are suffering from chronic illnesses. Panchakarma will aggravate the problems in them. I had somebody I knew in Adelaide, and in Adelaide there was a school that was teaching Panchakarma, and they had a course going on there. And this person that I knew, she was suffering from cancer. And when they were studying Panchakarma, they obviously asked who wants to undergo Panchakarma. So the common understanding of a human being who has studied basic Ayurveda is Panchakarma is for cleansing the body. And Panchakarma is like the treatment for every disease in this world. So she said, I will do it. And she underwent vomiting treatment. And after the vomiting treatment, she became so weak. She lost so much of weight and she became so hyperactive, anxious that I had to actually tell her that why did you undergo that? Because that's absolutely not necessary to undergo. It caused severe vata aggravation, resulting into severe complications in her case. So one has to be very careful about where to administer Panchakarma, to whom to administer Panchakarma. Panchakarma, what we understand in daily routine as Abhyanga, which is application of oil on the body, Udvartana, which is basically scrubbing the body, Nasya, small quantities, couple of drops, that is fine. Okay, that is also called as Panchakarma on a daily basis, but that is very, very mild, that can be followed. But the actual Panchakarmas, the Vaman, Virechan, Basti, Nasya, Raktamokshan, in the quantities which are prescribed in the books, that has to be only given to people who can bear the capacity or bear the strength of the process, and also when the doshas are very aggravated. Which are the panchakarmas that you can do in different seasons? In cold weather, you can do abhyanga, you can do fermentation, you can do head massage. In spring, Vamana procedure is advised. Okay, Vamana has to be done in the spring season because kapha is increased in the months before that, which is the cold weather. And in spring, when the sun becomes a little bit stronger, the kapha gets liquefied. So this is the ideal time for removal of kapha out of the body. Hence, Vamana procedure is done in the spring season. Udvartana, that is scrubbing, Dhuma, that is smoking, and Kavala, which is basically gargling. Holding, Kavala is basically holding the oil in the mouth. Those are also done in these times. In summer, you do Pralepa, which is masks, to negate the extreme heat and dryness. In rains, you do scrubbing, Udvartana. In autumn, the heat causes aggravation of Pitta, hence Snehapana, which is drinking the oil or ghee, and Virechana and Raktamokshana is done in autumn. So this is basically the basic understanding in terms of which season, which karma to be done, which procedure to be done. Having said that, if suppose the doshas are so much aggravated, and even if it is a cold weather and the kapha is highly aggravated, you will do a vaman in cold weather because the doshas are so much that you cannot wait for the spring to come to do vaman. Okay. So you will not wait for it if the doshas are highly aggravated. But this is the general rule which season you will do panchakarma for getting healthier. I know so many people who used to suffer from bronchial asthma and have been doing Vaman procedure every spring. Every spring season they will do Vaman procedure and they will not have a single attack of bronchial asthma throughout the year. Why? Because the excess kapha has been removed. So there is no chance of any vata to cause dryness of the mucus, flame, and cause obstruction and result into any breathlessness or any kind of obstruction there. So people, once they experience, they do the process, even though it is time consuming, it is pretty strenuous on the body, etc. People still do it once they have experience. It is better to undergo through the to the pain. Pain meaning is just the time, and it is pretty. I would say your mental strength is tested more than anything else. Particularly in MS's treatment, I used to do. I was an intern with one of the doctors in Pune. I used to conduct the MS's treatment every spring season, and in one spring season, I used to conduct at least 300-400 MS's treatments. So we had like 5 or 6 bathrooms in the hospital, and every bathroom had one person sitting and vomiting. And we used to monitor all 6 in one time. Make somebody drink, then go to the next place, next cubicle, make the other person drink the liquid. Keep on making them drink, then they vomit. So observe what is coming out, then keep on doing it. So it is basically time consuming for the patient, and it is a lot of mental strength is tested, because the person goes through, like when I say that the person will doze off, you won't believe that the person sitting in the chair will just fall asleep there. He's so tired and the kapha is so much in the body that the person will doze off sitting, not understanding what is happening. When the headache starts, the headache is so much that the person feels as if the head is going to burst open. But you have to tell them that it is the pitta that is aggravated which is causing the headache. The moment the one more bout and the pitta is removed, the headache will stop. So it is only once that the patient experiences this, and once the patient experiences the benefits, we have seen people coming back every season to do that. So that is the general idea in terms of panchakarma and this. Then panchakarma in conditions of suppression of natural urges. So basically, avagaha, that is, you sit in a bathtub with hot water, salt, etc. Abhyanga, nasya, basti. Panchakarma in rasayan and vajikaran. Now, panchakarma is an integral part of the rejuvenation and vajikaran treatment. You have to clean the body. You have to clean the body before undergoing the rasayana therapy. And panchakarma in different diseases. So like we said, for kapha you do vamana, etc., etc. Those are the panchakarmas in different diseases. Now, this is very interesting, what I am going to show here. A lot of people, and you must have also said this sometime when you were starting to study Ayurveda, and a lot of people, they say, oh, I am going to go and get all panchakarma done. Okay, so this is a chart which will tell you, if you realistically decide to do panchakarma, how much time will it take for you to finish the procedure. The entire procedures to finish will take 138 days. And I have explained how. So if you start with Vamana, you start with Snehana and Swedana, that takes 7 days. Post that, on the 8th day, you ask the person to take foods which are incompatible to provoke the kapha dosha, that is the 8th day. The actual Vaman procedure is done on the 9th day. Samsarjan Krama for the next 7 days, so 9 to the 16th. Rest on the 17th day. Immediately start with Virechana. So again Snehana for, this is only for 3 days, so 3 days Snehana. Then warm liquid which do not aggravate kapha for another 3 days, so 23 days. Virechana on the 24th day. Samsarjan Krama for 7 days, so 31st day. rest on the 32nd day. Then you start with your Basti. Now, Basti is usually either for 8, 16 or 30 days course. So, if your most preferred is the 30-day course, so from the 33rd to the 62nd day, 30 Bastis are administered, followed by 60 days of rest. So, usually the ratio is for 30 days, you take double the rest and the Sansarjan Krama. For 16 days, you do 32 days of this. For 16 Bastis, you do 32 days of rest and Samsarjan Krama. For 8 Bastis, you do 16 days of rest and Samsarjan Krama. Then usually 7 days, so the Samsarjan Krama is for either 60 days or 32 days or 18 days, which will take you to basically 62nd to the 60th, 132 days basically. And then 7 days from here on, go on to doing, the Nasya 123 to the 129th day, Rakta Mokshan Snehan for 7 days, followed by Abhyanga for 1 day, and Rakta Mokshan on the 130th day. So people who say that I want to do Panchakarma, all the Panchakarmas, if realistically somebody is in a position, and when I say this, obviously has the strength to go through all this and has the doshas so much accumulated, still has to understand that it is not something that you come to Kerala or come to India for 15 days and say, I got all the Panchakarma done. If that is what they are doing, it's not as per the science. That means they are either not letting you do something out of this, they are doing it fast forward, which is going to cause problems with the person. First of all, when you come to a place in India who promotes we will do Panchakarma, usually they are not doing the actual Panchakarma. They are only doing the allied karmas. They are doing the Abhyanga, they are doing the Nasya, they are doing the Udvartana, they are doing the Svedana, they are doing the Snehana, they are doing the Shirodhara, they are doing the, Netra Basti, Kati Basti, etc. So they are only doing allied karmas, so they cannot be called as the actual Panchakarma. Because all these procedures, like I said, are predominantly the oleation and fomentation type of treatments. They are only going to oleate the body, foment the body, bring the doshas into the koshtha. Removal of the doshas is not going to happen by these procedures. Shirodhara is not going to cause any removal of doshas out of the body. Abhyanga is not going to cause any removal of doshas out of the body. So, I have purposely made this slide so that, because a lot of times students have asked me all throughout these years that how much time does it take to actually finish from start to end if I have to do all the Panchakarma. So, realistically, it will take 1/3. I would say even if you are doing 8 bastis, still 8 bastis is going to be, 8 and 16, which is 24 days. So instead of 90s, you are still doing 24-day procedure. So you will probably save another, I would say 50 days here. But still you cannot do it in anything less than 3 months. Even if you are doing only 8 enemas. So 3 months, minimum 94 days is required. And if you do everything correctly, 90 to 138 days is the minimum period required to undergo the entire Panchakarma therapy. We are not considering any kind of complications, any adverse effects of any procedure, if observed, will take additional time to recuperate, recover, gain back the energy and restart again. That timing has not been considered here at all. So, Samsarjan Krama is must. 7 days for Vaman Virechan, double the duration for Basti. Helps in restoring optimal strength, physical strength, recovery is also faster. Okay. Then 8 factors are to be avoided in this case. The 8 factors to be avoided during Samsarjan Krama is speaking loudly, excessive traveling, prolonged walks, excessive walking, continuous sitting, consumption of foods without the earlier food getting digested, or consumption of excess foods, irregular or incompatible foods, day sleep, and sexual intercourse. These are the 8 things which are to be avoided when you are on the restricted period post the Panchakarma. Now, in the notes, I have also mentioned, they have specifically given that if you indulge in any specific activity, what will be the signs and symptoms that will be observed in the body. So they have gone to that much detail and said that when they say that do not speak loudly or do not indulge, like for example, now I am speaking to you for 6 hours, okay, that will be prohibited if I have undergone Panchakarma. I may not be speaking loudly, but I am speaking for a longer period of time, which has to be avoided. So understand what they are trying to say. Speaking loudly is one thing. So shouting, screaming is one thing, but also speaking for longer durations also has to be avoided. And they have given what will happen if you don't obey that. So they have given the signs and symptoms in details. Excessive traveling. So you do Panchakarma and then you go on a long drive. You travel 1,000 kilometers in a car, not expected. You get into a flight and travel, though it is only 8 hours travel, but the speed at which you are traveling, the distance that you have traveled, the environment in which you are sitting, which is drying, that is also to be restricted. So Panchakarma you do, but then you have to avoid certain things as suggested, and they have given specific signs and symptoms that you will observe if these things are not followed. Okay, I will be sharing these notes with you. You will have these in your notes. Now, what are the therapeutic effects of Panchakarma? Therapeutic effects of Panchakarma are Agni increases, the disease is stopped, health is improved, sense organ functioning is improved, mind functioning is improved, overall health, complexion, physical strength, physique is also improved, ability to procreate is improved. So basically, the offspring is healthier, sexual vigor is improved, aging is slowed down, and prolonged healthy life is achieved. So these are all the therapeutic effects of Panchakarma. But obviously, cannot be done on each and every person, has to be done very wisely, properly, under the supervision of medical supervisor. So, the next part is the Dipana Pachana. I mean, we have studied all this, that what happens with Dipana Pachana, the same situation that we have studied in Ama, that has been explained here. So I don't want to, again go through all that as to, when to do Ama, when to do Dipana Pachana. The principle is simple. When there is Ama presence, do not start the Panchakarma without doing the Dipana Pachana. That is the idea behind it. Okay? Do that first, then only start the Dipana Pachana process. Okay? Now, I don't want to start with the Snehana because we got only about 8 or 10 minutes left. So, are there any questions that you have? Any question that you want to talk about, discuss, etc.? We can do that the next 10, 15, 20 minutes and then we can stop. Because I don't want to start a new topic, given that we only have a very short period left now, because we'll probably finish 2 slides and then, so rather I would start a new topic on a new day. Any questions? So who out of the students is attending the retreat this time?
Pedro and Amy.
No.
Oh, sorry, not Amy. Pedro and Valeria.
Because Amy has attended already, no?
Sorry, I mean Pedro and Valeria.
Okay.
Shall I stop the recording, Manisha?
Yeah. Please do that. Because even if we discuss it, will be mainly questions.
Yes.
Okay.
Recording stopped.
So for Pedro and Valeria, just